So we have a patient now going for colonoscopy. So we know it's gonna examine the lining of colon and rectum. Yeah, so ball preparation is very essential in that one. So remain NPO after midnight. Yes, is correct. Is correct. Okay, so always nil by mouth, especially because that is the part of the ball preparation. It usually start 4 days before the colonoscopy. Yeah, and just the prep juice. Okay, and then patient slowly goes to the liquid diet, and then it goes to the prep solution, prep juice. Yeah. So after midnight, you can't even have a water. Okay, so they want it clear. So nil by mouth. What about B? Complete ball prep with laxative as prescribed. And that's what we discussed, like last time also. Um, Most of the question in NCLEX are correct when it comes to as prescribed. Okay, we might have done hundreds of question and we never tick no to that one. So I haven't encountered a single question where we have ticked no. So this is always correct most of the time. This is the golden rule of NCLEX. What about C, guys? Expect sedation during the procedure. What about C? Can we expect sedation? Yes, C, definitely. Okay. We see lot of patients receiving the sedation for the procedure to ensure the comfort. Okay, so sedation is one of the common thing that we will use before initiating the procedure. Arrange for someone to drive home after. D is correct. If somebody is like having sedation already, then we really don't want to recommend them to drive. So that's why D is correct. Okay, because they will still be having some effect from the anesthesia. And resume usual diet immediately after the procedure. What will happen if we are just giving resuming the usual diet? Patient need to go back slow. Yes. Okay, because it will cause GI upset. So light food and liquid, that will be recommended. Okay, never go back to normal diet. Okay, question number 32. The nurse is caring for a patient after colon resection with colostomy. Which intervention are appropriate? Select all that apply. Nil per both before. After midnight, because they are saying like starting from 1200. So that's why Celia after midnight. Okay, that's what some place it depend like how they considering. Okay, after 1200 is nil by mouth. Assess stomach color and perfusion. A, correct? Yeah. What kind of stomach color we are expecting in patient with colostomy? We will definitely assess what kind of reddish pink. Yes. Okay, and it should be moist. If it is pale or dusky, then it can indicate the lack of blood supply, and which is emergency. Yeah. Drive shots, yes, it can be reddish pink, it can be. Yeah. What about empty pouch when 1/3 full? I think we have done this question before also when we did our pink indicate poor tissue perfusion. Yes, but it need to be pale along. If we are saying reddish pink, then okay, I'm not saying only pink, reddish pink. 1/4 full, yeah. 1/3 full is also good. Okay, because then it will prevent it, otherwise it will become too heavy and it will start pulling it away from the uh, skin. So B is yes. Teach to avoid food that cause odor or gas. Is that normally? So those will be the trigger foods. Sometimes you will see if we are doing the stoma care or we are changing the stoma bag, the what will happen that there will be not much uh, stool in that one, the content in that one, but it will be just filled with the gas. Okay, so that's why we will see B or C. So we need to avoid foods such as like beans are most common. Yeah, beans are most common. So C is correct. Apply skin barrier to protect surrounding skin. Is D correct? Yes, ABCD is correct. Yes, true. Okay, because like area around the stoma can have a lot of irritation. So that's why we need to apply that one. And what about E, guys? Expect the stoma to appear pale and dusky. E, no, because that's indicate low perfusion. And it is one of the medical emergency we need to inform. Alrighty, let's move to question number 33. We will do 50 question today. We will do 50 question today, and that will be finished our GI track. Okay, and that means all those 50 question will be on YouTube channel Nursingy. Likewise, all other previous live are over there. A patient report constipation for several days. Which intervention should the nurse recommend? Select all that apply. ABC. Increase fluid intake, definitely, because it's gonna uh, soften the stool. It will make it easier to pass. So this can be the one of the intervention. What about the increased dietary fiber? Does fiber help to stimulate bowel movement? Yes. Okay, because they add bulk to the stool, so that's why they will help it. Engage in regular exercise. Does physical A, B, C, E? Yes. Nice one, Omar. So C is yes. Okay. It will stimulate the peristalsis. It will help to move the ball. Okay. And what about D? Can we take daily laxative? No. Okay, because it will lead to dependence, and for like long term it will reduce the ball muscle movements. Okay, so we don't want to do that. Yeah. Yeah. Establish a regular toilet schedule. What about E? Yes. Okay, so this will help. This will help. If patient is going regularly on toilet like they have schedule, it will help to retrain the bowel, and it will prevent the further constipation. Okay, so E is definitely yes. Thank you guys for following and double tapping. Really appreciate. Okay, the nurse is teaching a patient about safe use of laxative. Which statement are correct? Select all that apply. And we already done bit of laxative. So these are the class of drug that treat constipation. Mostly they different in different way. So I should avoid long-term use of stimulant laxative because they can cause dependence, like we discussed in the last question. So A is correct. What about B? Bulk forming laxative should be taken with plenty of water. What they can cause if we are not taking plenty of water with bulk forming laxative, what can happen? Yes, it is correct, guys. What can happen over there? Obstruction. Okay, constipation, dehydration, and definitely obstruction. Okay, so we need to watch. Osmotic laxative may cause dehydration if overused. What about C? Can they cause? Yes, because they are osmotic laxative, they draw water into the colon. So overusing them can cause dehydration, and they can cause the electrolyte disbalance, electrolyte imbalance also. Okay, stool softener can be taken safely for prevention. D. Is D correct? Instead of taking the other one, can we can they take stool softener? Yes. Okay, D is always recommended. If somebody is gonna have them for a long time, Lexol tablets are especially really good. So stool softener, they can be taken safely. And what about E? Laxative are a safe replacement for dietary fiber. Is it? No. Okay, so E is, yes, D is very non-invasive, so definitely we will go with D. E is no. Okay, nice. Thank you guys for double tapping and sharing and following. A patient is admitted with severe diarrhea and dehydration. Which interventions are priority? So we are having severe diarrhea also. So patient can be losing electrolyte, patient can be losing lot of fluid. Yeah. So do we need to monitor fluid and electrolyte balance? Yes. Okay. So we need to make sure like it can't create any dangerously electrolyte imbalance. And what about B? Administer oral rehydration solution if tolerated. Just to be as tolerated. Yeah. So this is another, this is one of the another golden rule. If there is like something like that, if tolerated as prescribed, they are always correct. What about C? Place patient on contact precaution, because that can be infectious, something like C. diff or others. Yes or no? Yes. Okay, so C, yes. When somebody is coming with diarrhea, you don't know why it is happening. Okay, so unless we actual cause is found, you always treat. It didn't mention Fanta, it didn't mention, but that's why I'm explaining this one. Okay, you need to treat that patient as infectious, because it's always safety. Okay, so if we are not putting that patient into contact precaution, and later on they will show it's having C. diff infection, we mess up a lot already. So that's why, yeah, it can be anything, Jashmina, it can be anything. I'm just giving one of the example like why we need to do that. So at starting, always treat it like infectious, especially if you are working in the ER and acute services. Make sure we treat every patient, yeah, on stomach virus. Definitely provide a high fat meal for energy. Is D correct? Which kind of diet we can use? D, no. Okay, because high fat diet is gonna worse it. What kind of diet is commonly used? What fruit for diarrhea? What is recommended? Soft, liquid? Yeah. Thank you, Nia. Okay. We we don't want to use that, but you can use bread diet. Okay, that's easy to remember. In rice, banana. Yes. Okay. So banana, rice, applesauce, and toast. Bread. So that's easy to remember to give during the diarrhea. What about E, guys? Monitor for skin breakdown around perineal area. Is it correct? Yeah. E is correct. Okay. E is correct. Because frequent loose stool can lead to severe skin irritation, and it can cause breakdown. And if there is a breakdown, it can also cause infection. Okay. So that's why E is correct. more infection. Okay, let's move to question number 36. Thank you for double tapping, Cindy. Really appreciate. A patient receiving chemotherapy is prescribed ondansetron for nausea, which in nursing considerations are appropriate. So we know chemotherapy is always, we always administer antiemetics because their common side effect of chemotherapy is nausea and vomiting. Administered 30 minutes before chemotherapy. Is it correct? Yes. Correct, because it's gonna take that much time to start acting, and we know most of the patient with chemotherapy is gonna have the side effects. So A is yes. Just prophylactic measure. What about B? Monitor for headache and constipation. Is it one of the common side effect of ondansetron? B, guys. B is yes, yes. Okay, so this one is most common side effect of ondansetron. Okay, headache, constipation. ABG, it depends. Yeah. What about C? Instruct patient to avoid alcohol while on therapy. Instruct patient to avoid alcohol while on therapy. C is correct because we know it is what we can say. Usually, I don't think so. But the thing is that even though alcohol is not gonna have any interaction with medication on ondansetron, but it's still gonna have issue with safety. So yeah, that's what Jocelyn like. Avoid alcohol always, always. Yeah, and smoking alcohol. Yes. So yeah, monitor liver function test if used long term. What about day? Because yeah, because we know ondansetron is metabolized by liver, so that's why we need to monitor it. Okay, especially in the long term, definitely. And what about E? Watch for QT prolongation on ECG in high dose. Yes, yes about E. Because it can cause arrhythmia. We know ondansetron is known to cause QT prolongation, so we're definitely gonna watch that one. Thank you, guys. Question number 37. The nurse administer metoclopramide for nausea. Which adverse effect should be monitored? What about 37? So we know again this medication increase the GI motility and act by blocking the dopamine receptors. Okay, CRG zone. Okay, extrapyramidal symptoms. B, A yes. Is A yes? Yes. Okay, because metoclopramide is also medication that block dopamine receptor, and we have done that. We have learned that in last pharma also, when we know like typically antipsychotic medication block the dopamine, and that's why they have more EPS symptoms. So that's why, because this medication also blocking the dopamine pathways, dopamine receptors, you will see extrapyramidal symptoms over there. Okay, and what about B? Restlessness and anxiety. Is B common? Yes. This one of the common side effect of medication affects central nervous system. Okay. Yeah, so B is common. Drowsiness and fatigue. Arena. Mag. Okay. It's not only magnesium. Actually, everything can cause, like if there is low potassium, Low potassium can cause also QT prolongation, because in heart we have sodium potassium calcium pump also, so that's why you will see QT interval affected by that. Magnesium is the crucial role because they maintain the normal rhythm, and low level definitely hypomagnesemia cause the QT prolongation. But we are gonna do electrolytes tomorrow, so everything will be there. Okay, we are gonna do electrolytes tomorrow, uh, today actually, this evening 10 p.m. Drowsiness and fatigue, what about C, guys? Yeah, common expected sign of metoclopramide. What about D, severe hypertension? Is metoclopramide gonna cause hypotension or hypertension? What is the D? No. Okay, it cause hypotension. Okay, not hypertension. Yes, it cause hypotension. What about tardive dyskinesia with long-term use? Thank you guys for following. E, even if serious, this is very, this is actually severe effect. We, yeah, so they can cause tardive dyskinesia because it work on the dopamine, and we see that one into if A then E. Yeah, if it is serious. Yeah, okay, that's why you will see EPS symptoms. Okay, 3 more questions. We will have 2-minute break. A patient prescribed promethazine report excessive drowsiness. Which nursing action are appropriate? Select all that apply. So now we got promethazine. We know it is antihistamine. It can have antiemetic effect, but it can also have the sedative properties. Okay, so yeah, let's do this. Advise the patient to avoid driving and operating machinery. A, yes, because it does have sedative effect, so we really don't wanna, it can impair their ability to drive. What about B, encourage alcohol to help reduce nausea? I will go Marty, just give me a second. B, alcohol should be avoided. Yes, because yeah, encourage alcohol because alcohol is sedative. So if we are giving promethazine and alcohol, they both gonna work on CNS, and then you will see more sedative effect. So that's why we don't wanna do that. Administer via large bore IV at highest rate possible because it is sedative. Can we administer it fast? No. Okay, so C is no, not higher rate. It will cause respiratory depression, guys. Okay, so it should be, it can be with large bore IV, but at a slow rate. Okay, at a slow rate. Yes, it is very irritating, and ABG that will prevent the tissue damage and nerve injury. Okay, so that's why we give it slow rate. Monitor for respiratory depression in elderly patient. What about D, guys? D, yes, because it is it will work on CNS, so we need to watch for respiratory depression. And what about E? Educate about potential anticholinergic effect. Yes. So it will cause dry mouth, it will cause constipation, it will cause urinary retention. Yes, definitely. It does have anticholinergic. Okay. So promethazine have 3 properties. It is antiemetic, it is I know it is antiemetic, but it is antihistamine, it is dopamine, and it is anticholinergic. All three. Okay. Yeah. Yeah. So that's why you will see everything in this medication. Okay. Question number 31 or 39. The nurse is caring for a patient after gastric bypass surgery. Which interventions are appropriate? Thank you, Jason. Okay, now we have patient gastric bypass. We know usually patient do it to do weight loss surgery because size of stomach is reduced now and there will be less food inside the stomach. Start with small frequent meal when diet is resumed. Yes, we don't wanna, because now new stomach or small stomach is gonna allow very small diet, small amount of meals. So A correct. Monitor for dumping syndrome symptoms. What about B, guys? What about B, guys? Yeah. Yes, because we know why it can happen. Dumping syndrome usually happen when food, especially the high sugar food, move too quickly from the stomach to the small intestine. So now what happened in this gastric bypass surgery, stomach size is small. Okay, and when it is small, then you will see dumping syndrome symptoms more because food is moving into intestine fast. What about C, guys? Avoid fluid with meal. What about C? What's gonna happen if a patient is taking fluid with meal? Yes, yes, we're gonna avoid it. Okay, because now size of stomach is small, and then if patient is taking fluid, it's gonna fill up fast. Not good. Okay, encourage high sugar food for quick energy. Can we do that? What about D? I fell fast. Yes. Okay, no, because you will see dumping syndrome symptoms more. You will see dumping syndrome symptom more in high sugar, so you don't want to see that. Okay, so please avoid. What about E? Monitor for signs of anastomotic leak. So now we have a connection, like my drawing is not good. So now we have a bypass, we done here bypass, size is small. So now the surgical part is leaked. Okay, so it is serious complication because it can cause pain, fever, infection, tachycardia, everything. So that's why we need to avoid it. Okay, monitor the signs. Okay, let's move to last question before the break, and then we will have a couple of minute break. A patient who had recent abdominal surgery developed abdominal distension. Yes, Marty, definitely. Which interventions are appropriate? I haven't forget that one. We will go back to that. So patient has surgery and now developing abdominal distension and there is no ball sound, so that's definitely there is a obstruction going on. Okay, keep the patient nil by mouth. What we are seeing here, we are seeing paralytic ileus, temporary paralysis. Yeah, temporary paralysis, so we don't want to push it too much. Okay, so there can be obstruction, so until resolved, keep A nil by mouth. What about B? Insert nasogastric tube as prescribed. Yes, B is good because this is the only way that gonna help us to decompress the stomach. Yeah, and relieve the pressures. So B is good. We done that in last couple of few questions. Encourage ambulation. Is patient should be on rest or need ambulation? What about C, guys? Ambulatory. Yes. Okay. Not on the bed rest, because ambulation we done that also in last few question. Ambulation is very important because that help us to bring back the peristalsis movement. Okay, so exercise is good, ambulation is good. Administer opioid analgesic frequently. Yes, that's why it's just, it can be just walk. So we don't need to do the big exercise. It can be just, yeah, reduce DVT as well. Yes. Administer opioid analgesic frequently. No. Okay, why we don't want to give the opioid analgesics? Why we, it will cause hypoactive ball. Okay, so that's why we want to increase the peristalsis. That's why we don't want to give it. Okay, we will choose other pain medication. Monitor for return of bowel function. Matthew, no, actually it will just help us, and especially if it is written in the question as prescribed, it will be assessed before. Okay, otherwise we, if it is written like insert NG tube, we will say no. If it is only prescribed, because that will be under our scope of practice, so then we can do it. Okay, E, definitely we're gonna do that, because that will help us to assess, evaluate. No, Kristen, we are thinking paralytic ileus over here. This is not constipation, because somebody just had surgery and then developed abdominal distension and absent bowel sound. So we are thinking about paralytic ileus, because that can be temporary, especially after the surgery, abdominal surgery, and it will come back definitely. Can be, cannot be. Okay, because sometime when there is a lot of ball prep and other things also, like if depend like what kind of medication they are going on, what type of condition they have. Yeah, but it can be due to anesthesia. Okay, so this is, guys, this is our next 10 question also. So I'm gonna post these all question on nursing YouTube. Why do we keep the patient nil by mouth? Because the patient abdominal is already distension and there is no absent bowel sound, there is no sound, so definitely there is a obstruction going on. Unless we will resolve that and we will find out like what's going on. You don't want to keep pushing more fluid and food over there, because otherwise it will automatically increase the distension. If it is severe, there is higher chances of rupture also, but like we want to make sure patient is nil by mouth. Okay, question number 37, Marty asked. So here 37, the rest of you guys, if please, if you can search Narsingi on YouTube and subscribe, I really appreciate. Thank you for the one person who just went there. We always post these video over there. Okay, so you will have all my old lives over there. It get uploaded every day. I can show you guys.